has something to do with the numbness and tingling, because whenever you have a issue with the brain, it's always connected to the rest of the body. It's always, right? Imagine a computer CPU. Computer CPU doesn't work, the computer doesn't work, right? Our brain is a CPU of our body. If the brain doesn't work, some place in your body will not work, and most of the time is the tingling and sensation of the hands and feet. Okay, because our brain has a direct connection with all the nervous system, all the peripheral nervous system in the body. Okay, so once we found out that the patient has issue with the temporal problem with the beta wave, then we can use electrode and put on the temporal lobe here, and then use the computer to send out very tiny millihertz of stimulation into the brain, so the brain wave can start to be normalized. And we have done this treatment with a lot of patients that has tingling and numbness and pain and weird sensation, and it has gotten miraculous results. I'm talking about miraculous. Patients have gone through this where other doctor doesn't work, and this works for them. All right, period. I really like this machine. No feedback. Now, if you come in for examination, we talked about this at the beginning. You bring in your MRIs, you bring the X-ray, and look at your blood report. This is the room where I use to look at the MRIs and the X-rays. Okay. Now, this is the MRI film. Now, every time patient comes in, every time there's tingling and numbness, I always look at MRIs. Always. Why? Because MRI will give us information on whether your numbness is coming from the spine. For example, this particular patient. This patient, if you look at the spine here, first of all, we look at the color of the disc. The disc color here is very beautiful, nice and gray. You know, if you look at this disc, it's black. Black is always bad. If you look at the other, this is the spinal cord right here. Now, a lot of white spaces is good. Now, when you see on bottom here, there's a black stuff here. This is, we call it disc herniation. The disc comes out, bulging on the nerve here, causing severe tingling numbness of the legs and the feet. Okay, so this particular patient, there's two surgeons probably want to cut her up, but she doesn't want it. She come here for treatment and she's gone. The stuff is gone. The numbness, tingling, the pain, everything is gone. Okay, so like I said, when you treat a certain condition, for example, neuropathy, we gotta find out what's going on. And it's never ever one particular reason. It's always multiple reasons stacked on top of each other. We gotta have to cure every single issue from the body. Okay. The next instrument that we have to treat the peripheral neuropathy is, we call it whole body vibration. The whole body vibration is this particular machine right here. Now, it has a huge base, a plate, where you stand on the plate. Let's just say if you have numbness on both feet, you step on it, and the machine is going to start to vibrate in different hertz, different mode, different angle. Okay, it really depends on what kind and how severe the condition is. Depends on the reason of the neuropathy. If the neuropathy is just coming from the feet only, without any connection to the spine, to the brain, to the food you eat, to the allergy, to inflammation, if it's only just the feet or the hands, then we can use machine to let it vibrate. Because when it vibrates, it causes circulation. The circulation of the blood start to move, right? The spaces of the nerve which is in moves. So everything moves, and it's just open up all the channels. And when the channels opens up, nerve just flow. The blood just flows. Okay, this is a really good machine for that as well too. Now on top of that, this machine is good for rehab. If, let's just say, your back, your neck, your hands and feet are all healed, right? And we can help you strengthen the muscle of the neck and the back, strengthen the muscle of the arms and legs. This machine is perfect for strengthening muscles, for rehab. Let's just say if you exercise for an hour, instead of exercising for 1 hour on the machine for 10 minutes, it has the same effect as if it's doing 1 hour of exercise. Okay, very good machine. So the program we offer for patients is extremely unique. It's extremely different from the medical route that you've seen. This is you have already heard the whole thing. Extremely different. Extremely comprehensive. So what we treat not only the nerve, not only the neuropathy. Of course, that is our primary objective, but we are actually treating the whole body. We're making sure the body is healthy, so the body has the ability to heal the nerve itself. The body will have the ability to heal the brain, to heal the spinal cord, to heal the organ itself. Okay, that's our secondary main objective. Okay, so our program will not be doing medication, will be no surgery, no shots. You're gonna feel more energy. You're gonna feel younger. You're gonna feel 10 years younger. Okay, you're gonna sleep way better. You are going to have better circulation. Your hands and feet are going to start to feel warm. There'll be no constipation. Okay, you have the body. You're probably going to have body aches, joint pain, muscle pain. All the pain is going to disappear as well too. Okay, you're going to be very mentally clear, and you're going to feel very healthy. You're going to feel light because your weight is going to be lifted up at least 10 to 15 pounds every single patient. Okay. So how does it work? We offer a 2 free consultation. Okay, if you qualify. So the consultation works like this. So we will probably give you a sheet, an intake form for you to take home and fill it up, or you can come in and fill up the intake form if you want to. Okay, once you fill up the intake form, then you come in for the first free consultation. The first free consultation where you sit down in front of we do face to face, and we discuss the full history. And we review, if you brought in any MRI, any X-ray, any blood tests, I review that with you. Okay, and if I feel that you need more testing, which almost everybody does, then I'll give you the prescription for blood tests, for other tests, for MRI, for nerve tests and all that. You go home, get that test done. Okay? And before you go home, I'll also do some pausing to see what's going on with your pulse, to see what's going on with your body. Okay, well, I'm going to write those down as well too in my note. Okay? And you go home. Once you get the testing done, you come back for the second free consultation. The second free consultation, where I will give you a full review, a report of finding of everything you did. Your MRI, your blood tests, your X-rays, your nerve tests, whether you did the spine scan, the brain scan. I just put it all together and discuss with you the entire body overall health, and the cost, the primary cost of the numbness, tingling of your foot and hands. I'm going to tell you, give you the report of finding. And once you find out what you have, what's going on, then my assistant is going to come in and discuss the financing with you. Okay, but remember that we do not take every single patient. We do not. You have to be qualified. Now, what does that mean? Qualified means that we have certain requirements, certain criteria. If you want to be our patient, you have to meet these criteria. And what are they? You cannot smoke, first of all. Smoke and drinking, we do not take patients that smoke and drink. We simply do not. Why? They don't get better. People that smoke, the toxicity of the smoke is so strong that it's going to affect the nerve, that no matter what we do is not going to help. So unless you're willing, if you are willing to get better, quit the smoke, go home, quit it. Quit your drink, quit your alcohol, and come back. Okay, if you can't quit, but you wanted to quit, let us know. We have a smoking program that will help you to quit the smoke. If you're taking more than 1 or 2, I would probably say 3 medications, especially if you have statin medication. The side effect of the medication we discuss is so major that it's going to interfere a lot with the healing. If you want to get better, you got to discuss that with me during the free consultation. Okay, discuss what you want to do. How are you going to address that? Okay, are you going to be going back to a medical doctor and discuss it with them, maybe change some kind of medication? Or have your family doctor work with me to help you get better? Okay, so let me know. Okay, and if you're not willing to change your diet, now we discussed that diets are very important. If you do not drop the sugar, if you do not drop the wheat, if you do not change, if you do not stop eating the nightshade vegetables, are you kidding? Are you not going to get better? You're not. So don't even come if you're not willing to control your diet. Diet control, I always tell patients, is the primary. Once your diet is in place, you are already on your way 20-30% better. Already on your way. Okay, if you're not willing to take supplements and herbs, homeopathic medicine, if you're not willing to take those, I'm sorry, you're not going to get better as well too. Okay, because supplement increases healing, because body needs nutrient. If the body doesn't have the nutrient, for example, nerve needs nerve nutrient. Spine, if your nerve is compressed by the herniation, the spine, the herniation, the herniated disc needs nutrient. The muscle needs nutrient. If you have issue with the brain that affects the the numbness, tingling, the brain needs nutrient. And the food is just not enough. It's just not enough nowadays, the food, because so much environmental toxins, so much depletion of the soil that causes the issue. Also, if you do not have a strong desire to get better, I always ask patients from 1 to 10, 10 being like you would do anything to get better. If you have a strong will, a strong desire to attend, like you would do anything to get better, then you are the right candidate. If you're not, if you are probably like 5 out of 10, if you're not really sure if you want to get better, if you just want to check it out, then I probably will not take you in. So once you have gone through the 2 free consultation and you decided to get the treatment, we will go over your entire diet plan. We're going to go over the supplement that you will need. Or we are going to go over all the treatment plan, the machine, what you're going to do, how much time we're going to help you, how long is it that you need to care. We're going to discuss all that with you in detail. And also, we got to mention that pain is never ever better in few visits. So do not expect miracle that you're going to get better, that you're going to get totally healed within 3, 4 visits, 6 visits. Now, it's not possible. Now, if you have the issue for more than 10 years, do you expect us to fix that within 1 month? It's just not possible. Okay. On average, the total healing time for patient is, like I said, 2 months to 6 months. Some patients 3 months, some patients 2 months, some patients 4 months. It really depends on how severe. It all depends on how many layers of issue that you have. It also depends on the amount of commitment that you give it to us, the amount of cooperation that you give it to us. A lot of different factors can come in place. Okay. Now, once you come in for the visit, the first 3 visits, sometime the first 3 visits, you may have a little more issue, more symptom. Why? The body is adjusting. The body is adjusting to the treatment. The body is adjusting to a different environment, different food, different program. So the body, while in adjusting phase, you might feel more discomfort. Okay, but it's okay. After a week or so, it's going to go away. Okay, that discomfort is going to go away. Alright, so there is a decade rule that I always discuss with patients. If you're a 30-year-old, it'll take about 3 visits for you to start feeling better. If you are a 60-year-old, you're probably going to take 6 visits before you're going to start feeling some kind of improvements. Okay? And now, one of the most important aspects of the consultation is having your spouse here. Why do I say that? Because your spouse is a huge factor in determining if you're gonna get better or not. Huge factor. If your spouse is 100% supportive of your treatment, you are going to get better much faster. If your spouse is against you, if your spouse is fighting with you, if your spouse is against you taking supplements, against you coming here, if your spouse is against you spending money on treatment, I've seen a lot of those. Trust me, I've seen husband do not want to spend money on wife. I've seen wife do not want husband to take supplements. I've seen all kind of stuff. And those kind of patients will not get better, and I will not take those kind of patients. They just don't get better. Okay, so your spouse has to be here. Your spouse needs to be here. They need to understand your entire system. They need to know what's causing all that discomfort. They need to know why your hands and feet are numb, why you cannot feel, why you keep on dropping cups, why you can't walk for more than 10 minutes. They need to know. They need to care for you. If your spouse do not come, they probably do not care enough. Okay, so it is your job to get your spouse over. It is your job to get your spouse to watch this video. It's very, very important to have your spouse support. Okay, emotional support, physical support, financial support. All the support you have to have it from your spouse. Okay, and everybody asks me, how much does it cost? Does my insurance cover? I do not know how much it costs because everybody is different. Everybody requires a different program. Everybody, the treatment is going to be different. Okay, like I said, when you come in, one person is totally, even though the symptom is the same, one person's cost will be entirely different from another person's cost. Okay, so the money is going to be different. So my insurance does cover. Well, you got to come in. Insurance only cover certain percentages. Some insurance don't cover, then you have to pay cash. If the insurance does cover, most of them do not cover all of it. They are very rare. There are very few insurance that will cover all the treatment. Very few. But most insurance will not. They'll probably cover only the chiropractic adjustment part. They'll probably only cover the modality part, but the rest of it, they probably will not cover. So expect it to pay a fair amount of money for the treatment. Expect that. Okay. Of course, bring your insurance card over, or you can call us ahead of time to let my staff know what insurance you have, so she could kind of check it for you before you come. So she'll tell you the coverages, chiropractic coverages. Okay. And Medicare do not pay. I'm sorry, we're not in the Medicare program. Obamacare, it's only for the poor. They don't pay anything at all. Medi-Cal do not pay. They don't pay anything at all. Okay. HMO, they don't pay. All right. I'm so sorry. Okay. So are you ready for changes? If you are, give us a call. Okay. One last advice that I want to give you before we end the video is, if you have pain, if you have numbness, if you have tingling, do not force yourself to exercise. Do not force yourself to run, to lift weights. A lot of patients think that I'm just going to work it out. I'm going to endure my pain. I'm just going to run, and I'm just going to exercise. It's going to go away. No. If the symptom is with you for more than 2-3 months, it will stay with you. It will not go away by itself. Okay, don't carry things heavy. No, don't carry heavy things. Don't think you're strong because your spine is already damaged. Your nerve is damaged. So do not overload your spine with more weight. Do not overstretch. If you have discomfort stretching, don't stretch. Okay, if you have problem with limbs, hands and feet, don't overuse. Relax it. Okay, don't go over massage it. If you go to a certain massage area, they crack your neck, they crack your bone. Cracking the bone, it's very dangerous. Do not let anybody do it unless they are professional. Okay, all right. Do not think that it's going to heal itself. It's not. It will not. Do not eat bad food. Do not go to restaurant. Do not eat sugar. Do not eat the carbs. No coffee. Okay, this is very, very important advice I'll give you. All right. Okay, so if you're ready, if you're committed for treatment, if you are willing to do anything to get better, give me a call. My phone number is area code 626-281-0510. 626-281-0510. This is my email. You're welcome to email me for your tool-free consultation. Thank you very much. This is Dr. Lin.